Good afternoon. Today we are going to talk about diabetes.
Diabetes is a chronic disease in which food cannot be converted into energy because it is converted into sugar called glucose.
A healthy pancreas produces insulin, which will act as a catalytic sugar and convert it into energy.
In people with diabetes, the pancreas does not make insulin, so glucose does not enter the cells and they become sicker and sicker. If there is not insulin, glucose cannot enter the cells of our body and they do not function because they lack energy. There are three types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes.
If you have type 1 diabetes, your body does not produce insulin, so you need to give it every day. This disease is autoimmune and is the most common in children and adolescents with diabetes. It is currently not preventable.
Whereas in type 2 diabetes, the body does not use the insulin it produces and therefore does not maintain normal blood sugar levels. This type of diabetes is the most common in the world population and can be prevented by a healthy lifestyle.
In contrast, gestational diabetes occurs in pregnant women who have never had diabetes before. It usually goes away after the baby is born, but increases the risk of the mother developing type 2 diabetes or the child growing up.
In addition, there is prediabetes, where blood sugar levels are very high but not high enough to become diabetes.
At first, diabetes is a silent disease. Its symptoms are always hungry, unexpected weight loss, numb or tingling hands, feet, frequent urination, extreme fatigue, always thirst, and problems with healing.
People who are at risk of type 2 diabetes are those who have prediabetes, are overweight, have family members with diabetes, have high blood pressure, have had gestational diabetes, have a sedentary lifestyle, have heart disease, have had a stroke, have depression, have polycystic ovary syndrome, or who are smokers.
How can I prevent or delay the onset of type 2 diabetes?
Most of the things you should do involve a healthier lifestyle: losing weight, exercising, not smoking, replacing soda with water, eating healthy food, and seeing a doctor if you have symptoms.
What care do diabetic patients need to stay healthy?
Diabetic patients must inject insulin and monitor their blood sugar levels. Self-monitoring is required to be healthy, as this routine is done at home, not in a hospital. All of the above, along with eating a balanced diet and exercising.
Many scientists are researching a cure for diabetes, and although it cannot currently be cured, insulin therapy allows patients to live completely normal lives, as long as they learn how to care. It is one of the most common diseases in societies around the world, and most countries have health plans to treat it. Now, whether you are diabetic or not, it is important to be aware and take care of the daily habits that will promote a better quality of life.
We invite you to learn more about diabetes, and thank you for watching this video. See you later.